Chronic fatigue syndrome, also known as myalgic encephalomyelitis, ME for short, are conditions characterized by profound fatigue. However, fatigue on its own is not unusual. Many people will suffer from fatigue, even chronically for long periods of time, at least 3 months, and many conditions have the symptom of fatigue. Therefore, what differentiates chronic fatigue syndrome and ME as clinical entities and diagnoses compared to simply fatigue as a symptom? It is something we feel, but it isn't itself a diagnosis. So what is the difference between the two? One key symptom of chronic fatigue syndrome and ME, which is pathognomonic, meaning that as soon as you see this symptom, it really should have light bulbs go off about chronic fatigue syndrome and ME, is something called post-exertional malaise. Post-exertional malaise, in a nutshell, is a drastic worsening of symptoms after exerting yourself. Now, when we talk about exertion, really it's any little stress we put on the body. It can be physical, which people tend to think of. It can be cognitive, if we have to think really hard. But it can also be things such as emotional, if we are in a very emotional situation, put stress on the body. And actually it can be sensory. If we're in really bright rooms, really noisy rooms, that's sensations coming into the body, and that can lead to stress. So any of those can really be categorized as an exertion. So we have some exertion like that, and what we see is a disproportionate level of symptoms occurring afterwards compared to the initial trigger. So the initial trigger may seem minor, however the symptoms which occur after it are disproportionate. When we talk about the symptoms, these do include a worsening of fatigue. However, that you perhaps may expect. If you exert yourself cognitively and physically, you would tend to expect a worsening of fatigue. That in itself is not unusual. However, in post-exertional malaise, there are symptoms which you simply would not expect to occur after exerting yourself. These include worsening sleep, memory, concentration, and flu-like symptoms. So you may get swollen glands, a sore throat. All of those are symptoms of chronic fatigue syndrome, and they get drastically worse after exerting yourself, and they are symptoms you wouldn't tend to expect when exerting yourself. The combination of the variety of possible triggers, it's not just physical and cognitive, it's emotional, it's sensory, that with the severity and disproportionate level of the symptoms, along with the unusualness of the symptoms, as a collective give post-exertional malaise its distinctive characteristics. This post-exertional malaise is such a core part of chronic fatigue syndrome and ME that a new word for the overbranching condition is systemic exertional intolerance disease, really trying to encapsulate that one of the core issues with chronic fatigue syndrome and ME is the intolerance to exertion. It's not just that they feel tired. The actual core thing which makes them different is that when they do exert themselves, they get this disproportionate increase in symptoms. The post-exertion malaise is not the only diagnostic criteria. They do have to have the profound fatigue for at least 3 months. It used to be 6 months, but nowadays, if it's really a clear clinical picture, that can be limited to 3 months in order to speed up the diagnostic process, but historically it has been 6 months. That also needs to be combined with the post-exertional malaise and sleep disturbances. So they have to have those three for sure. They have to have profound fatigue for at least 3 months. They have to have the post-exertional malaise, and they must have the sleep disturbances. Along with that, they also have to have either cognitive issues, so issues with concentrating, issues with their memory, paying attention, or they have to have something called orthostatic intolerance, where they have issues going from a seated to a standing position or standing for long periods of times. They have to have at least one of those. And once they have that diagnostic criteria, then they can be given the diagnosis of chronic fatigue syndrome or ME. And that is a look at what distinguishes a chronic fatigue syndrome as a diagnosis compared to just chronic fatigue as a symptom. In individuals with chronic fatigue syndrome, they have this post-exertional malaise or the exertion intolerance, where as soon as they exert themselves, they get that disproportionate level of symptoms, and those symptoms are a bit unusual in terms of what we would expect after exertion. Thank you for taking the time to watch this video. If you liked it, then please do like it. If you have any comments you'd like to mention about this video or any other topics that you think may be also of interest, then please leave a comment. And if you'd like to see more of these videos, then please subscribe.